BioBalance Healthcast episode 155, Side Effects of Testosterone Replacement, Part 2.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Hopefully, this is a welcome back to you. We are going to continue a conversation today that we began in our last podcast about the risks and side effects of taking hormone replacement therapy, in particular replacing the hormone testosterone. And last time we talked about things like facial hair, hair loss on the top of the head, voice changes, the things that people come in and say, if I do this, I've heard that this can happen. And we didn't get all the way through the list. There are some other side effects that people have questions about that sometimes happen to some individuals. And today we're going to talk about things like oiliness of the skin,
acne,
development of acne, increased muscle mass, enlargement of the clitoris, temporary hyper-sexuality, vulvar swelling and itching, and liver tumors. So we want to get through all 6 of those today.
So I'll try to be succinct.
Well, that would be helpful.
Okay, so oily skin and acne. Most of us who have gone through testosterone deficiency have no oil in our skin or in our eyes, which gives us dry eyes, or oil in our hair, so our hair is no longer shiny. So we want some oil, but sometimes our bodies overreact, especially when they've been deprived of something like testosterone. So there's an overreaction. Sometimes it remains, actually, but not often. So the oiliness leads to increased bacteria on the skin, which leads to acne in some people.
When you went through puberty, these issues would have manifested in your life.
But I never had acne in puberty, and I've never had acne from this.
Yeah.
I mean, you either have that in your history and it'll recreate what you were doing when you were young, or you don't. So I usually ask, have you ever had that problem before? And many women say, well, no, but my friend has it, and that's an issue. And but we can help this.
You say recreate what you were doing when you were young. That's one of the goals. I want to be able to have sex again. I want to be able to run a mile again. I want to be able to have a good time again. I want all these good things.
I don't want to be depressed anymore. I want of the good things of being young.
But I may also get oily skin as a result.
Honestly,
so am I willing to accept that?
I don't mean to belittle these risks, but there's not very many risks that are dangerous in there, and we can fix all of them or prevent them. So to me, these are I guess I'm going to use the word petty, but they're a little petty because your whole life's down the tubes if you're going to take testosterone. I mean, you've got a million different symptoms, and you're feeling terrible if you really have this syndrome, and we're going to give you all that back, make you healthy.
Right.
We can treat these other things. It shouldn't be a deal breaker that there's a risk of acne.
So when we say, what are you willing to pay to get this quality of life back?
But
we're
they
not
don't
just
even have
about the
to
money.
pay it.
Yeah.
Because we can counteract it.
Right.
Acne and oily skin are dose dependent.
So it's a false choice.
It is, kind of. Yeah. Because really the risks we can prevent, and that I try to do that. But sometimes I don't catch it the first visit, and I have to catch it the second. So we do address it. But acne and oily skin are things that we treat with the same thing we treat facial hair with, which is spironolactone, it's the diuretic, or finasteride, and either one of those will handle it.
So how does a diuretic decrease oiliness?
Well, the diuretic works on the kidneys, of course, but it also works on the adrenal gland, and it suppresses aldosterone.
God, I love that you know this stuff. I keep trying to come up with a random question that you don't know the answer to.
Well, I should. It's my field.
Well, I don't, so it's not mine.
So it decreases aldosterone, which also increases facial hair and blood pressure.
So it might be a side effect that you have. It might be more or less severe, but it is treatable, and in many people it is preventable with certain interventions.
That's right.
Okay.
That's right.
So what about increased muscle mass? I mean, some women worry that if you give them testosterone, they're going to bulk up.
Right. I find...
Is that another one of those?
That's another one that I kind of go,
really?
Oh, yeah, good, I'm going to bulk up. But if you go back to the 60s and 70s, and if your mentality is still kind of honed in on Twiggy, we were all trying to be as skinny as possible. And I remember like dating an athlete and going, oh no, I'm not going to go lift weights. I'm not going to go run because then I'll get muscles and then I won't look Twiggy-ish. We all wanted to look anorexic. So if we
what's
still
funny is
had that mentality.
Twiggy was hot when the sex goddess was Marilyn Monroe.
I know.
And if you go back and look at pictures of Marilyn Monroe, the gal was plump.
I know.
I mean, in
Plump
today's world,
standards.
by today's standards, yeah, she wouldn't be the same image.
Although
so
people talk about her more than Twiggy. Norma Jean.
Yeah, Norma Jean.
So in any case,
Candle in the wind.
If you don't want any muscle mass, if you're somebody who feels terrible when you get a little ripple in your arm and you can see part of your bicep and think that's fat, looks fat, first of all, you're misinformed because that's healthy. Second of all, probably this would help you because you need to have muscle to burn calories. You need to have muscle to stay upright. As we get older,
wow.
It's not broken bones that are our enemy. It's no muscle because we can't stand up straight.
It's also an issue for a number of women because of historical reasons. A lot of women have body distortion, body image issues around weight and around being muscular because of cultural messages that they received in their childhood and adolescence. Parents that said to their daughters, you can't gain weight, you can't get fat. You know?
Right, and they feel that gaining muscle is gaining weight.
Right.
Well, you do gain muscle when you get testosterone.
And muscle is heavier.
And muscle's heavier than fat. So we always say the picture of the big yellow fat glob of 1 pound of fat equals this much muscle.
Yeah.
You shrink, but the scale's not a good way to measure this.
Exactly. I mean, my wife frets over that all the time, and you tell her. I mean, she gets replacements, which I can say, Kathy
Yeah,
can't,
I can't.
for her hormones, and she's constantly fretting over getting on the scale and saying, my weight's not dropping. But her body shape is changing,
Right.
and she's becoming slimmer and more muscular, but she's holding the weight because the weight is muscle and not fat.
And at some point, generally, if you're overweight, which she's not,
No.
then if
Well,
you're
yeah, that's a
overweight,
different issue. If you're overweight,
yeah.
you're dropping weight. That
What happens is for the first 6 months, usually you're losing fat, you're gaining muscle, the scale stays the same. You may be losing some inches on your abdomen, which is really healthy. Then after this first 6 months, as you're building muscle, and it'll be 6 months if you do exercise, then you're building muscle and you're burning calories all the time. You're burning calories when you sleep, you're burning calories when you're awake, because your muscles are always very active in terms of using up energy. So it should be a good thing, but if someone doesn't want a lot of muscle, I tell them not to use whey protein, because that bulks muscle.
W-H-E-Y.
Right, that bulks muscle up. And I tell them that I will decrease their dose of testosterone and that they should not do any kind of bodybuilding exercises
Right.
or weights. They should do running or biking or something that's aerobic. So that's one way to get around it. But honestly, I think it's very healthy to have muscle, and that's my goal.
Yeah, and again, we're not talking about the extremes. We're not talking about putting you in a bodybuilding contest for women.
We don't do that. That's not what happens to your body either.
Yeah.
I mean, I'm not going in a contest for that. But guys do ask me if I'm a long distance runner because my calves look really good. So that's something that I don't run. I used to. I don't run
But you
anymore.
walk a lot.
I walk a lot.
Yeah.
And I do elliptical and all those things. But I don't run, and I haven't put in the effort to get those. That's testosterone.
Right.
So
Okay, so ready to shift?
I'm ready to shift.
Talk to me about clitoral enlargement. I bet men don't say that to you very often.
No, they don't. But at least in my office they do.
Well, they might. Yeah.
And, only when they're with their wives.
And clitoral enlargement and increased sensitivity.
Right. Okay, so what happens is the clitoris is a very sensitive organ. As you lose estrogen and lose testosterone, it shrinks and it hides behind this little hood that goes over it. So basically it's almost hard to find in people who are menopausal or have no testosterone or both. So when we give people testosterone and estrogen, we get this overreaction of the body. So the clitoris enlarges and it becomes more sensitive because more blood flow goes there. When you get testosterone, blood flow starts going to your muscles, your brain, and it goes to your pelvis, because if you are past this point, you know that everything shrinks and gets dried up in women who don't take hormones. Their vagina shrinks, it gets shorter, the bladder is more sensitive, you get bladder infections, everything thins out, no blood flow. I mean, minimal blood flow. So when you get testosterone back, you get tons of blood flow to your pelvis, and everything kind of swells a little bit at first. It's an overreaction, it's limited. And then it goes back down to where you should have been when you were younger.
Do you have this? Do men have the same thing in terms of erectile dysfunction? Is it a similar process about blood flow?
Yeah. Yes, absolutely.
So as they lose their testosterone, blood flow diminishes. So those capillaries in the penis don't get the blood flow, and so they have trouble getting an erection.
Right.
And then when you give them testosterone, as opposed to some of the other manipulators of that, then
it dilates the vessels. It improves the musculature around the penis and in it.
So they get better erections.
They get better erections.
And more sensitivity.
Right. And they get larger because you shrink when you don't have testosterone, and you know, so the penis gets larger. So
now, that's not dramatic. It's not like the ads you get through the emails that are unsolicited.
No, and it's not meant for that. It's just meant to go back to your normal, not.
Yeah. No, it's recovering normality because you've lost it. And the joke about old people shrink. You know, the older you get, the more you tend to
get shorter.
Smaller. You get shorter. The same thing happens with these dimensions of the body.
Absolutely.
Because the hormones are not there. The normal process that you've always known and experienced is not there. And if you replace it,
then
it restores.
It comes back. But it takes a little while. So we're going to also talk about the swelling, itching kind of thing, because it's involved in this.
Okay.
The longer you've gone without estrogen, the longer you've gone without testosterone, the more you find this return to hormones to be irritating. It's not about the clitoris enlarging or becoming sensitive. For people who've been off hormones or not had any for a long time, it's about so little blood flow going there beforehand and then a lot of blood flow going there. So for a few weeks in the first month or two, women who are in their 60s, who are starting on hormones and haven't been on them for 20 years, they feel itchy. They think they have a bladder infection. They think they have a yeast infection for about 2 weeks. And really, it's just the blood flow. It's like if I put a
It's like if
rubber
you go to
band
sleep on your arm
on my
and you wake up and the blood starts to go to your arm.
It gets itchy.
And you get all those feelings and tinglings and stuff. And you're like, oh my God, what happened? And you're talking about women who've gone maybe 20 years without having those hormones and therefore not having that level of sensation in and around the vagina. Suddenly starting to have those sensations.
Right, the nerves wake up, the blood vessels wake up, the muscles start developing again, the vagina gets wetter and larger. All of that is a response to the hormone coming back. So it's like, whew, it's like watering a plant that was almost dead.
Yeah,
you
and
know?
you see it revive.
And you see it revive. But while it revives, some women, and usually it's older women with long-term loss of hormones, get the itching, burning, and they see their doctor and they say, there's nothing wrong with you. So I tell them ahead of time,
you need to expect this may happen.
You need to expect this in the first month or two, and it'll last a couple of weeks, and you can use ice, and you can take Benadryl. Those two things help the symptoms, but like an ice pack.
Because it numbs.
It numbs it.
Because when we talk about increased sensitivity, there are hot, cold touch, and pain sensors at the skin level, the cutaneous sensors throughout your body. And your erogenous zones are called your erogenous zones because of the density of the sensors in that location.
There's also stretch.
And those have gone to sleep by the loss of the hormone. When you restore that hormone, those erogenous zones will wake up. So you have increased sensitivity that you haven't had.
But it's not forever that you have an overreaction. It just goes back to normal. So in a few months after pellets are inserted, you're pretty much back to your normal anatomy before menopause, before you lost your testosterone. That's what we're looking for. Now, some women have a clitoral sensitivity to testosterone. They feel really good on a higher level of testosterone. That's fine. But one of the drawbacks would be, and I don't consider it a drawback, would be that their clitoris stays slightly enlarged. I mean, the clitoris is like tiny.
Yeah, it's not going to be like somebody's going to come in and go, oh my God, what happened to you?
Except doctors.
Yeah.
Okay, here's what we're trained in GYN. If you are looking, picture the pelvic position, you're looking at a woman who's menopausal, past menopause, and she has an enlarged clitoris. That says tumor to you, because
Right.
if you're,
It's on your checklist. It's like
it's
at the
on
very
your
top.
checklist,
Yeah.
and so it's like, oh, warning, warning, but it doesn't do anything to you. It's just a sign doctors were told might be a danger sign.
So check for tumors.
Right, but if you're taking testosterone, it's a normal finding. It's not a tumor.
Right.
I mean, that's not what it is, and there's nothing wrong with it. It will go down unless you want to have a high level of testosterone. It doesn't hurt you. In fact, I think it's an advantage because at least they can find it.
So we share some clients.
Yes.
I mean, we got into this relationship because we have client overlap. And I had a couple, man and his wife, come in and talk to me one time after they had seen you for the first time and had gotten, both of them had gotten hormone replacement pellets, bioidentical. They came in together, and the woman was distraught because she had always been pretty pristine in her sort of sexual investment. And she was suddenly having lots of desire, which she didn't quite know how to handle, and she was afraid she couldn't regulate it. She literally wanted to know if the mailman was safe or if the clerk at the store was safe, because she was having these thoughts that she'd never had. And the connection that she made, it was like the very first week after. And the connection that she made was, well, before I had these pellets, I didn't do this. Now I have these pellets. Oh my God, I'm a changed woman. So talk to me about temporary hypersexuality that sometimes comes with the replacement of testosterone.
Well, most of the women that come to see me want their sexuality back.
Or if they didn't have it at that level.
But some women never had a very high testosterone level, never had much sexuality.
Right.
So it's a bell curve. There are some people who always had a lot of sexual.
Some were anorgasmic.
And some had very little.
Right.
And they weren't used to the testosterone. But they had symptoms of low testosterone and they needed to have it.
Right.
So no matter what dose I gave them to begin with, their system would, I always tell them it's receptor sites. When I give you the same dose as another person, if you have all your receptor sites open waiting for that molecule of testosterone to come by because you have so little, they're all open waiting.
Yeah, like hello sailor.
Yeah, right. They're all waiting for the testosterone. And so in the first, as soon as your level gets up high enough in that first month or so, they all fill up with testosterone and there's an overreaction. Then over time, the next month, some close, some open, and they pick up the testosterone. So everything goes down to a nice calm. So I can't make that happen again, which some women say, oh, that was awesome. I was, I don't know, swinging on the chandelier. But I can't make that happen again.
Right.
So not only can I not make it happen again, it's not going to happen again if we redose you, because you have to go years without having this hormone to have all your receptor sites waiting for a testosterone.
I'm laughing because I'm thinking about 101 Dalmatians when they have the all dog alert and every dog in town is barking. And so that's what I'm visualizing when you're saying all these sensors come back.
All at once.
But it's a 1 or 2 time deal. It's not.
It's a one time. It's usually a one-time deal.
Yeah.
In general.
Yeah.
And I mean, I felt that as well, and I know what that feels like, and it's very disturbing. It's like you have a new compassion for the 18-year-old boys you dated, because you feel like an 18-year-old boy for a couple weeks, and it's like, oh yeah, the UPS guy looks pretty good.
It was a hard life. It was.
It had to be.
Yeah.
I mean, it really had to be. That's a really upsetting feeling. But it only lasts 2 weeks, and then the rest of your life you don't have that again.
I read a study somewhere years ago, and I cannot cite it now. It's just one of those random facts stuck in my head. That the average teenage boy thinks about sex once every 7 seconds.
That's probably true, and of course, women don't have quite as much testosterone, and neither did I, so it wasn't quite that bad.
Right.
But it was kind of overwhelming for a couple weeks. So, in general, I ask them, especially if they have had a deceased or partner, they're divorced, if they have an outlet for this, because they want the other things. They may not want a sex drive, but that's not their mission. You have to talk to them about
masturbation.
Right.
You have to talk to them about friends with benefits. What are you going to do?
I don't talk to them about that.
Well, but that's the kind of stuff I talk to them about. I know.
But I do talk to them about.
It's reality.
I know it is. I know it is. I mean, I'm not a psychologist. I'm not a counselor. So I talk to them more about Have you ever
Let's talk about the
used
medicine.
a vibrator? I mean, people in my age group
Yeah.
sometimes have never even considered that.
Or they don't know where to get them.
Right.
You know, I couldn't walk into one of those stores. Oh my
Drugstore.com,
God. Yeah.
and I'm not on their payroll, and they'll send them in a little brown box that looks
Plain
just
brown
like a
wrapper.
prescription.
Yeah.
So drugstore.com has them,
Yeah.
and they're under personal items. In any case, they have to have
A release.
a release for this,
Yes.
and sometimes we decrease dosage because
Right.
it's a little bit too much, but then we give away some of the treatment value also.
Yeah.
In any case, this is not something that people talk to me about a lot.
Right.
But
It's not a real common
because they're
result.
usually beaming and happy and their husbands are happy and they've got their wives back and now they have a sex life again.
Or they talk to you after it's over and they've started to normalize.
Right.
You know, it's
Or
like,
they say, I want this back.
Yeah.
Somebody left me because I couldn't do it again. It was
Yeah.
like, I want to do that again. And I'm like, I can't do it.
Yeah.
And I won't do it. That's not normal.
Okay, one more symptom that we need to
Mm-hmm.
talk about, liver tumors.
Testosterone has a reputation for causing liver tumors.
Mm-hmm.
Birth control pills as well cause liver tumors.
Okay.
Only when they're treated orally. Only when you take testosterone.
When the delivery mechanism is oral.
Sorry. Only when they are delivered in an oral method, where you're
Okay.
taking a pill. Birth control pills and oral testosterone both can cause liver tumors or liver cancer. This, when you're taking
And
it
that's
as a
because
pellet,
of the first pass effect
right,
and
it goes through the liver
metabolization
first.
issues.
Yes, and it's a very high dose that goes directly through it, and what it's broken down into, it's not good for your liver.
But there's absolutely no correlation, no causation for non-oral delivery methods, whether
That's
it's
right.
creams or pellets or whatever
That's
it might
right.
be.
There is not.
Okay.
So that is completely safe if you don't take it orally. And that's really all I have to say about that, because
Yeah. Well-
you can still take your testosterone. It's not something to worry about. But we don't worry about it when we're talking about birth control pills. No one says, oh, I'm not taking birth control pills because I might get a liver tumor, but it is a possibility.
And since Kathy never says, that's all I have to say about that, this is a really good place to end this podcast. Well, hopefully you will have gotten some information that's interesting and useful for you as you consider the question, should I replace my testosterone? Thank you for listening.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Find Brett Newcomb at brettnewcomb.com.